10:42 on the clock. Vivek और निकिता आपके साथ हैं. And yes, it's a lovely Tuesday की सुबह. Is it a lovely Tuesday?
It is a beautiful Tuesday.
तूफानी Tuesday is it?
हाँ, आज हम लोग ने बहुत सारी बातें की about a lot of things.
तूफानी Tuesday बोल सकते हैं. आज का जो दिन है ना, तूफानी Tuesday.
Bringing value to the organization as an employee, हमारा क्या value है, learning that. Then about talking about alternatives to sugar जो हम लोग ने कल बात की थी, उसके ऊपर हम ज़्यादा बात करेंगे very shortly with a doctor. And also apart from that, we also did speak about sugar जो beverages है उसके ऊपर एक 50% excise duty होने वाला है from the 1st of Jan 2026.
तो आपको ध्यान देना है कि वो थोड़े से ना महंगे हो जाएंगे. नहीं कंज्यूम करना. दिस इज द गवर्नमेंट का मेन प्राइमरी गोल कि इसको हमको कम करना है. ऐसा नहीं कि मतलब बंद ही कर दो. बड़ा मुश्किल हो जाता है फॉर अ लॉट ऑफ पीपल. इसको ना कम करना बहुत ज़रूरी है ताकि अपना हेल्दी लाइफस्टाइल हम मेंटेन कर पाए. बिकॉज ओबेसिटी, डायबिटीज ये सारे ना डायरेक्टली लिंक्ड है विद दीज शुगर बेवरेजेस.
Absolutely, and excise duty की बात करें, it is imposed on specific goods that are generally harmful to people's health and the environment. So its implementation is basically aimed to reduce the consumption of such products while generating government revenue that can be reinvested in essential public services. अब UAE में already ऐसे taxes पहले भी आ चुके हैं into some products in 2017, जैसे कि carbonated drinks, energy drinks and products with tobacco in it. So yes, this is one way forward about sugar beverages which will come into effect with excise duty 50% happening from 2026.
So इस पे और बात करने के लिए स्वप्ना मेरी जॉन, डॉक्टर स्वप्ना हमारे साथ है, क्लिनिकल डायटिशियन. अच्छा डॉक्टर बोल सकते हैं क्या? क्लिनिकल डायटिशियन. ओके. इंटरनेशनल मॉडर्न हॉस्पिटल से. शुड वी से डॉक्टर स्वप्ना और शुड वी से जस्ट स्वप्ना? गुड मॉर्निंग.
Just Swapna, you can say good morning.
Good morning, Swapna.
सो ये जो है
Good morning.
बहुत इम्पॉर्टेंट है फॉर अस टू नो कि जो लाइफस्टाइल डिजीजेस हमें होते हैं, डायबिटीज ले लीजिए या ओबेसिटी ले लीजिए, ये बहुत सीरियस डिजीजेस है, हार्ट डिजीजेस एज वेल, which are associated
Yeah.
directly linked with sweet beverages.
Yeah, yes.
So Dr. Swapna,
Actually,
the report that we were talking about is about stevia getting all the mileage now and being considered as an alternative for sugar. What do you have to say from your experience, as a clinical dietitian?
yeah, actually, stevia, it can be considered a healthy alternative for regular sugar. Mainly, it contains 0 calories and does not raise the blood glucose or insulin level. And it's more suitable for people who are diabetic and who are trying to manage the weight. And but it's still like entirely, it's not free of concern. Like some people experience mild digestive discomfort from certain stevia blends, like especially which contains mixed with the sugar, alcohol, and all. And also some studies it shows like adding it like regular use of very sweet tasting substitute, making it harder to reduce overall sugar cravings in our diet. That's about the stevia. Like we can replace, but still there is some concerns regarding that.
Right. So Swapna, there are a lot of people who are moving into diabetic, range, and especially in the UAE, the adults are about 20.7% is what the, the diabetic, results have shown in the past, and there are more people
diabetic.
increasing.
So
What do you have to say about shifting towards stevia and alternatives to sugar?
Yeah, it's recently we can see many UAE residents, especially those with diabetes, obesity, and metabolic syndrome, have started switching to this stevia. But similarly, and also non-nutritive sweetness and all, they are more aware about this healthy diets, and we can see also in our supermarket or in the shelves like zero sugar, low fat, so many alternatives. So, replacing sugar and also make broader dietary and lifestyle changes is very important. Not only just swapping the sugar to this non-nutritive sugar like sweetness, and also we have to make some changes in the lifestyle and dietary habits. That's very important.
As we speak, we got a question. Is processed brown sugar, is it good in any form?
Processed brown sugar compared to the white sugar, it's good, but still it's like same calories and all. It's like less processed, so it's not completely removed, like it's not bleached completely, but still it has some like normal calories as normal sugar.
Okay. We got another question from Paresh. All right.
Yes.
I think we can move
So,
forward.
Doctor, if you can talk about, Swapna, if you can speak about the importance about, choosing stevia extracts and, rather than the mixed sweetener products in terms of health outcomes, is there anything that people need to be cautious about while using stevia?
Yeah, stevia, the pure stevia one is more good than the mixed one because the other sweeteners have more effect in the long-term effect in our system, like digestive issues, and it can affect the kidneys, liver, like that. So it's a natural form of sweetener. Stevia is a natural sweetener, so it's always better to choose stevia rather than other sweeteners.
And considering the high number of diabetic patients in the UAE, how is stevia helping in clinical practice with glycemic control and calorie reduction from your experience?
It's we can in our clinical side we see people who are swapping the sugar to the stevia, but still it's very important to looking into overall calorie consumption. It's not only just removing the sugar from the diet. Overall, like they have to choose all whole grains. They have to reduce the fat intake. They have to choose the healthy fat, and overall calorie reduction is very important. Not only just avoiding the sugars and taking the stevia. It's very important to consider other factors also, and lifestyle changes like they have to keep moving, they have to do some exercise. All these are important along with this.
So, Swapna, if you can explain the importance of less sweet preferences rather than simply sugar free options from a dietetics perspective.
In a healthy approach, it's always better to reduce overall sweetness. It's not just swap sugar for stevia. Using small amount of stevia temporarily can help during the transition period when people are trying to avoid the sugar from their diet. But the ultimate goal should be training our palate to enjoy less sweet food. That's very important. Also, people should read labels carefully because there is so many misleading products are available now, as many stevia products on the market are mixed with other sweeteners also and other fillers. Choosing pure stevia extract in moderation is very important. Always read the labels carefully, and it's always emphasize on whole food, fruits, balanced meals, and it helps in better long term results actually.
Swapna, for a general understanding, what in the labels should we see or get? It's like a red flag. Now, this is something that we should definitely avoid. What are those things, those items? If you could just highlight one, two, maybe?
Yeah, actually, they say it's sugar free, but sometimes corn syrup or like other sweetness like aspartame, sucralose, all this can be added in that. So always read the labels carefully. It's not like zero sugar means table sugar they will avoid, but they add it or add other fillers like this.
And
Even
Swapna,
if
you very well highlighted about, reading the food labels. How about
yes.
any behavioral change or the overall dietetic changes that patterns that people can adopt while, reducing their consumption of sugar alongside the alternatives of sugar like stevia? What are some of the advice that you can give to people?
Can you repeat the question? I didn't
So, Swapna, we're
understand.
basically asking what role does the behavioral change happen in your consumption of stevia? Is there a change in behavior that people can expect? And their overall dietary patterns, is there some way that you can suggest towards reducing sugar?
Yeah. Okay, actually, people who are more depending on this sweetness, no, they tend to crave more sugars in long term. So it's we can just consider it as a transitional period products like stevia can be used when you are trying to reduce the sugar from the diet. Overall goal should be reducing the sweets from the diet and enjoying less sweet food. More into we have to more consider adding more natural products like fruits and fruit juices or like dates kind or dry fruits, etc.
Now it is festival time. Diwali is around the corner. Another 15, not even 15, 14, 13 days to go, 12 days to go. Not even 2 weeks. Wow.
Yeah.
How do we stay away from these amazing Indian mithais? Please tell us, Swapna.
How to control?
There is always alternate like healthy alternatives. You can use like mango purees or some fruit purees for making your dessert, or you can use date syrup. You can use all these are options, and honey can be used instead of taking the normal processed sugars.
The Kaju Katris, the Motichur ke laddus. How to stay away? Very hard. But yeah, a healthy choice is something we should all think of, right? But
Yes,
during
yes,
festival, 1 day, two
for
days
our
is
health.
okay. No problem.
I always suggest not to go for sweets.
Ah, okay.
Oh, strict, huh? Ekdam strict.
So, Swapna,
Wow.
how
Yes,
about,
yes.
consuming figs? Those dried figs that you get when you have a sugar rush. Is that also
Anjeer.
recommended? Or you feel that's also high in
Yes.
sugar?
Anjeer cream.
You can take dry fruits, but always remember that all the nuts and these dry fruits are also high in calories. So it should not be taken in a very huge amount. You can just take one fistful of that per day.
Thank you, Swapna, for being on air with us and for sharing your insights. It's really valuable to all of us and our listeners there. So we wish you all the very best and thank you so much for being again on air with us. Yeah, have a good day.
Thank you. Thank you so much.